Hello, I am Dr. Michelle Afonso. I'm here with Hector behind the camera. Hi, Hector.
Good morning.
Good morning. So we're here to talk about a topic in dentistry that is pretty important. It's something that we don't want to have happen, but if it does, you want to be prepared, you want to know what to expect. So today's topic is dental injuries. So a dental injury can come from a fall, from an accident, it could even be sports related. And they range in severity. They can be something mild, like a bruised tooth, or something more severe where a tooth gets knocked out of the mouth. And for some of these injuries, it's important to go to a dentist immediately and have that tooth or yourself checked out. So I want to give the general idea of what to do and what to expect for the more common dental injuries that we see come into the office. And for a lot of these injuries, it's very important what you do the moment that the accident happens. So getting right into it, the first injury that I want to talk about are mild injuries called a bruised tooth or a concussed tooth. This is something that happens if you bite on something hard, like a hard candy, if you accidentally hit your tooth with a fork or you bite on the fork. And kind of like the name, it's a bruised tooth, so it's going to feel sensitive to touch, to pressure. It could even be a little hot and cold sensitive as well. When this happens, one of the good things you can do right off the bat is start taking some NSAIDs. So that's going to help the healing process, help the tooth feel better sooner. And kind of like the name suggests, and what a bruise is, when you have a bruise on your arm or on your skin, if you kind of poke at it, it's not going to get better quickly. So you want to go on a soft diet if you have this type of injury. Gives that tooth a break, gives it a chance to heal a little bit better. And from there, you can go see your dentist. We would take a look and take x-rays. We would make sure there's no internal injuries with that tooth. And a lot of the times with the bruised tooth, we give it time and we let it heal, and it typically subsides on its own with the help of those NSAIDs. So that's that first injury. We're going to move on to something more severe, and that's called a partially avulsed tooth. So let me break down the dental terms. A partially avulsed tooth is a tooth that was knocked out of its place, but is still partially attached within the mouth. So it's something that you're going to visually see that the tooth was dislodged from the original position, and you're going to feel it in your bite. You're going to feel like something feels off. You're hitting something a little heavy. So it's the more severe injury because it's something that you want to kind of take care of quickly. What you will do when that tooth gets pushed out of the place that it originally was from the impact, you want to take the tooth by the crown and you want to grab it and you want to push it back into the socket, into the place where it should be. And you want to do this quickly. The reason you got to do it quickly is because the body has a natural mechanism of healing once that tooth is out of place and that socket has an open space. And what the body does is it starts forming a blood clot. But if the blood clot forms before you push that tooth into that space, it's going to act like a blocker. So it won't have that path of insertion that you need to get that tooth back into place. So ideally, you get that tooth, you push it right back as close as you can to where it should be. And then you come to see the dentist. Take some NSAIDs if you can on your way to the dentist, and once you're there, we'll evaluate the tooth with some x-rays and photos and take a look for any internal injuries. If the impact was enough, there could be some fractures on the tooth that you see, on the crown, or on the root system. So with dental injuries, it can be very case by case. So we're giving you a general idea of what to expect and what to do. With that kind of injury, once you're back into the dental office and we get that tooth back into place, we're going to splint it. Kind of when you have a broken toe and you splint it together, you want to do that with adjacent teeth using a flexible wire. So we'll bond a wire to the back side of the teeth that you won't see so that the tooth that was injured has some support from its neighbors and gives it some more time to heal and stay in that space that we want it to be. From there, you continue seeing that dentist for regular checkups where we would take a look and see about those internal injuries I talked about or any need for a root canal. And I don't want you to worry when it initially happens. Just get it checked out and have your dentist take a look at it and give you his opinion or her opinion on the next steps. Now there's a cousin to that kind of injury, and it's called a completely avulsed tooth. So that situation is one, let's say you're out playing football and the football has a nice spin on it. You think you're catching it, but it ends up hitting your face. That injury with enough impact can knock a tooth out of place. So with an injury where the tooth is knocked out of place, there are some steps that you want to take. So this is more severe, and the reason it's more severe is because there's more action that you want to take in the moment it happens. The things you want to do, first thing, to understand, if the tooth is knocked out, you only want to touch the tooth from the crown. So what that is the part in your mouth that you see when you smile, that's the crown of the tooth. That's where you can grab it. The root system will be the pointy end, and you want to leave that alone. Don't brush it, don't clean it, don't touch it. The reason you want to leave the root system alone is because it has very important cells there. It's made of blood vessels and nerves, and you want to keep those alone and try to keep those vital and healthy. So once you have a good hold of that tooth, let's say it fell on the ground. You know, you're out there playing football, you're probably in the dirt. If it fell on the ground, it has some dirt and debris on it, you would go get a gentle rinse of cold running water over the tooth for 10 seconds at most. You don't want to expose it to too much water, but help clean it, help get that debris and dirt off. And then from here, if you can, you're going to get that tooth and put it right back into the socket. Similar to the case before, to avoid that blood clot blocking you from being able to put that tooth back into the place it's supposed to be. Now, some people might say, no way, I can't do that. I can't put a tooth that was on the ground, put it back in my mouth, and that's understandable. So if you feel uncomfortable or you're unable to get that tooth back into the place that it was in the mouth, your next step is to store that tooth. So the way that you should store that tooth, the medium that it should be put into, is milk. So milk is one of the more readily available mediums that a tooth can be stored into while you get yourself to the dentist. And the reason why we like putting the teeth in milk is because it's a pH neutral solution. So the cells that we're trying to keep alive and healthy, those cells don't mind the milk and they won't be damaged by it. So it's good in the meantime while you go see your dentist. Some people might say, well, water is more readily available than milk. And that's true, but water is not a good solution for the teeth. So water is a hypotonic solution, so it can actually damage those very important cells. So don't put the tooth in water, don't leave the tooth dry. Try to get some milk, find a container or a cup that you can put it in, and get yourself to the dentist. So those are some steps you take immediately once you have that type of injury, that the tooth gets knocked out. And you want to go see your dentist as soon as you can. I mean, within the next 30 to an hour of that injury happening is the best case scenario. The reason you want to go see your dentist as soon as you can is because that tooth has been exposed to that outside environment. So the outside environment is dry, that can damage those cells, and there's bacteria and debris that can also damage those very important cells of those teeth. So once you're at the dentist will evaluate if you put that tooth back in, you know, where it's at. It will most likely splint it. If the tooth was left out of the mouth, we'll talk about how long the tooth has been outside of the mouth. We'll talk about options as to, do we do some treatment on the tooth before we put it back in, and give you an expectation of what to expect in the next coming weeks and in the future. So with this more severe injury, with all these steps, because the tooth was exposed to the environment, there's a risk, and a higher risk for this injury, that the tooth and those cells don't remain vital. So the tooth could die, and that's again talking about needing a root canal. And these are all very case by case. So it could happen in the moment that you have the injury, you go see your dentist, he might decide to do a root canal on that tooth, or retry and give it some time, see how that tooth does. All these situations can happen, but in a general sense, it's a higher risk of that tooth dying and needing more treatment when it gets completely knocked out. So you don't want to panic when you have these type of injuries. Have this video on the plan B or back burner. Make sure you kind of have an idea of what you can do. And there's one more point that I'd like to discuss that some people kind of know about, some people don't. And it's when you have trauma to a tooth, especially trauma that is enough to knock a tooth out of its place. The tissues that are vital, they can die off. It could have the tooth can have the blood supply get cut off. And what happens when the tooth goes through that, the tooth essentially is dying. And when that happens, you might notice that the tooth becomes discolored. So you'll start noticing that the tooth looks a little bit gray, definitely starting to stand out from the next door neighbor teeth. And that concerns a lot of people because now we're going to the realm of aesthetics, especially if it's a front tooth, and someone can notice if one tooth is more gray than the other. So if you're in that situation where you've experienced trauma to a tooth, maybe the dentist is saying, let's wash this tooth and give it some time, or it has gone through a root canal, you might notice that discoloration. So what we do in those cases is something called internal bleaching. Internal bleaching is where the back side of the tooth, or the chewing side, we make a small hole in it and we put some bleaching material inside the tooth. So what that's working on is on the inside of the tooth, the dentin, and it's going through the tubules and it's trying to help that color get back to a normal shade and whiten. So similar to how you hear people say, I bleach my teeth to whiten, we're just doing that on the inside of the tooth. And the dentist who's monitoring you, either your general dentist or maybe the endodontist, because for the internal bleaching to happen, the tooth will need a root canal. In the time that they have that bleaching, he's going to temporarily close that hole, and then you're going to go about a week or two with that medicine in there, trying to get that color to improve. And you're going to have regular monitored checks with your dentist, and then once you get to a color that's desirable, that agent is removed from inside of the tooth and that hole is filled back up, and then you get a final restoration, whether it's a filling or a crown. So don't worry if you have a history of trauma and your dentist is giving you regular follow-ups and then all of a sudden you start seeing, wait, my tooth is changing color, it's getting really dark and really gray. It's something that can happen, and it's good to have that expectation of, okay, this could happen and there's something that you can do about it. So that's the general most common injuries that we see come into the office. Again, the main points is not to panic. Take some NSAIDs whenever you have something like a very hard impact on your teeth, and kind of follow those steps to try to give the teeth the best chance of success. And if you ever have any questions in the moment of the injury, call up a dental office. You'll get someone on the line and they should be able to give you some basic instructions on what to do. And again, we don't want this to happen, but if it does, it's just really good to kind of be prepared and know what to expect. I really appreciate your time. Thank you for being here, and I hope you have a wonderful rest of your day.